Now, Dr. Awudu, you touched on something about BMI, and it's always been an interesting one for me.
Yeah.
BMI amongst ethnic minority Black women in particular, there is, how do I put them? There is some school of thought that BMI is old and it doesn't actually categorize Black women well, or when they were devising BMI, we were not in the sample group that was used. My view
Yes.
is that it's an indicator.
Correct.
There are loads of indicators. It's one indicator. It's not the ditch we want to die on, but you can use it as an indicator. But what's your view?
Yeah, that's spot on. It's an indicator. The whole point of the thing of BMI is about assessing risk. Who's at risk of, initially, I think, if I'm not mistaken, was related to risk of heart diseases and strokes and stuff like that. But you're right. It was done in a population of Caucasian subtype. You know, it didn't account for our varieties in our hips, our body,
our bones,
body shape, our bone density, our diet, and all that. You know, so over the years, it's less relied on.
Yeah.
There are better risk assessment tools, Q risks and Framingham, that we use for assessing who's at risk of cardiac diseases and strokes and all that. But it's still a quick tool, again, to help you indicate, could there be more?
Yeah.
Should I look into it a bit more in your case? So
Yeah.
I wouldn't completely discard it,
Same.
but I wouldn't rely on it as we used to as grail. Oh my God, my BMI is this.
Yeah.
No.
Yeah.
Like you're right. You know, someone said, a bodybuilder, if you check them, it's muscle mass, but they're just going on weight and height. Your BMI will be considered obese, but you're looking at it, him or her, and they've got a lot of muscles and very lean fat.
Yeah.
So purely an indicator, and not to be used as the holy grail for determining any sort of true risks.
Fabulous for me.
What would you like me to say? I was actually going to say, I've had a high BMI before, and there's a psychology to it.
Yes.
You know, so you sit in front of this nurse or whoever, and she's working it, and she's like, your BMI is high, you know, you need to drop your weight. I actually started getting a bit interested. You know, when they're establishing the risk for diabetes, they take like waist measurement. I actually don't understand what that means. So
I prefer that indicator. I think that's a better
in my head, I'm trying to work out the scientific link between my waist and my...
that as an indicator. Because there is a scientific basis for it. I can't remember off the top of my head, but there is scientific basis for it. So women above, I think maybe 32 or 33 is, I can't remember. But
there's something called metabolic syndrome X.
Okay.
And that's where that falls into, where the abdominal girth is considered much more important in terms of your risks as compared to just your BMI.
Exactly.
Because
so you can have your BBL and a tiny waist, like, as opposed to I'm actually making a serious point.
Yeah, I agree.
You can have really, especially as a Black built woman. Well, some Black built women. I'm not built that way, but you can have a really big hips and really flat tummy and be perfectly, but you on the scale.
That's spot on, exactly. So basically what you're saying, and that's exactly what it's saying. Two patients, one with a body type, narrow abdominal girth, big hips, and on the scale says BMI 30. Another patient, somewhat slim, but quite massive tummy, she's at higher risk. Yeah. And her BMI might be 27.
Exactly.
But she's at higher risk of developing cardiac conditions because all the studies have shown that abdominal obesity is associated with higher
so all the Coca-Cola bottle-shaped girls, right on.
Exactly. And I was basically going to go to that BMI is an indicator mostly within the medical sphere. But when we come to beauty standards, it's important for us all to remember that no two people are going to be alike, even twins. And so I think the more we are trying to make ourselves remove and reverse conditioning about body types and how that is linked to whether you're fit, which is the word, or whether you're overweight or whether you're underweight, and whether you should be taking this or doing that. I think for me, my messaging is always, you have to know yourself, understand your body. And yes, beauty is great and we have fads and some work and some don't work, but it's really important that you do what works best for you and what is safe for you as an individual.
Absolutely. And it's also best that you accept your body shape as well. We can't all be a size 8 or a size 10 because we're not built to be a size 8 or size 10. I'd love to finish by saying, especially as Africans, I'm African, Nigerian, I would love for us to get back to accepting all shapes. You know, there was a time where the ultimate standard of beauty was that curvy look. It switched to being very thin. I think it's switched back now to the BBLs of this world. And it will continue to switch. We can't control what magazines and beauty standards are being pushed, but we can accept our own beauty and lean into our own beauty.